Greetings, ladies and gentlemen, and welcome to our webinar by Intellectsoft. Today's topic is digital health strategy, leveraging emerging technologies in healthcare. We are going to outline the current state of medtech during COVID-19 and recent innovations that our company has built for our clients from the sector. I'm Diana, and I represent Intellectsoft business development team. And I will be your webinar moderator today. I will also be accompanied by my colleague Tim.
Hi guys, my name is Tim. I'm one of the solution architects here at Intellectsoft. My specializations are mobile solutions, web-based platforms, and also everything that is connected to health tech and blockchain technologies. Today, I'll help you to discover all of our case studies and will help you to find applicable technology for your use case.
Before we start, please note that you can leave all your questions at the chat, and we will make sure to cover all of them during Q&A session at the end of the webinar. And also, if due to lack of time or any other reasons, we won't be able to process all questions, we will definitely send elaborate answers via emails after the webinar. So let me begin with a short overview of our company. Intellectsoft was founded in 2007 and since then has grown to full-fledged boutique digital transformation consultancy that provides cutting-edge engineering solutions for global organizations, software development services, and emerging technology solutions. Our mission is to provide enterprises and startups with extended technological capabilities that could help them overcome challenges on their digital transformation roadmap. Our headquarters is located in Palo Alto, California, and our delivery centers are located in Eastern Europe. We also have onshore sales and consultancy presence all over Western Europe and US. Over 13 years, Intellectsoft has built a strong customer portfolio that includes world brands from both Fortune 500 enterprises and startups that are just on the way to becoming unicorns. Our portfolio includes a number of E&C companies for which we completed numerous projects, starting with simple mobile development up to carrying out complex IT infrastructure organization and integrations. Over the years, we have got awarded and recognized for our technological excellence and capabilities to deliver quality solutions for customers from such verticals as construction, hospitality, financials, and of course, healthcare. So let's move on to the topic of our webinar. And today we will start with overviewing the most crucial transformation trends and areas at the healthcare domain. We will also cover the ways how medical organizations get digitally transformed on a few practical use cases. And I want to start with small engagement. So I'm curious if you're planning or already digitizing some of the processes in your business. So you can see right now pool. And if you're going through digital transformation or in the process of planning one, please answer yes. If you're not there yet, just answer no. And please answer don't know if you're not sure about the company strategy. Okay, I'm giving some time so you can answer them. So thank you for your answers, and we will continue our webinar. I wanted to highlight a global problem that we have faced in every country. It's COVID-19. I guess there is no place on earth left which was not touched on the road. We even can see it through global economy. First of all, speaking of the ongoing healthcare crisis, I'd like to mention that as coronavirus continues to spread around the world, more and more enterprises are to miss their financial goals. There are more things to mention. First of all, I want to highlight that healthcare industry actually is one of the hardest hit sectors by COVID-19. Uh, it's also one of the most difficult tests faced by humanity in modern history. And no one knows when the pandemic will end. So even now, when we speak and like we sit at homes or already in our offices, we really can't predict what might happen next. Also, due to the spread of coronavirus, we also have faced dramatic increases in healthcare data. Data is a crucial element for understanding the current crisis and its effects, as well as for learning how to manage it. Especially, we can remember how there were a lot, like variety of different kinds of COVID-19 data that was tracked from different services, and developing the data standardization here becomes absolutely crucial. Data is all of the more important when you consider that major advancements in information technologies over the past few decades are now coinciding with more or less total state of lockdown, considerably increasing the amount of data generated by human interactions. While data is often understood as a raw material that needs to be shaped to make sense, more and more people are calling for a return of raw data or data stripped of all external interpretations. We also realize how it's essential to have data interoperability standards. So, doctor in Canada will easily understand what a doctor in Australia wrote about the patient. Knowledge exchange and access to the latest trends in treatment can become crucial points in winning towards COVID-19. So there became more data in every industry, but as we see in the healthcare sector, it increased dramatically. So everyone expects it to grow almost 6 times by 2025. There is also tremendous application potential for big data as enterprises are increasingly investing in this technology to streamline their operations. Big data analytics is enabling the development of data-driven applications targeted to improve business agility. Any response to an increased demand for raw data must be accompanied by reinforced vigilance with regard to the quality of data and metadata. And because of the urgency of the situation, this response must also take into account the need to update and circulate the data quickly. It's therefore highly likely that these criteria will play an increasingly crucial role in the evaluation of data, both in the healthcare sector and actually in any field that suffers long-term due to pandemic. It's economy, transportation, environment, tourism, etc. So with this market increase, we will need to find more ways to check it correctly, fight with deep fakes, and create new algorithms for analyzing and automating business processes. Today, the digital health industry market players transform or expand their service offerings to support management of COVID-19 pandemic. Government institutions, hospitals, and healthcare incumbents are in need of digital health solutions that will help them stop the massive virus spread and actually empower patients through their journeys. The digital health market is forecast to expand over $200 billion by 2020, driven particularly by the mobile health market, wireless, and telehealth. By the way, we will tell you more about the difference in the next slides. Now, when we're all sitting at home and can't even reach our doctors, if it's not an emergency situation, of course, we all understand the importance of telemedicine. Even though I haven't worked in the healthcare industry for decades, I still remember the time when everyone was more worried about regulations than beneficiary of telemedicine. Question number one was in every conference, who will be responsible for the mistake? Developer who created an application, doctor who made a wrong assumption, or a client itself who reached professional. Thanks to COVID, now we realize that telemedicine is a perfect solution for patients and physicians sheltered in a place and maintain a safe social distance, and medical assistance can be and should be provided from homes. Global telemedicine market size is forecast to reach more than $41 billion by 2021. I also wanted to tell you some differences between mobile health and telehealth, just because a lot of people think that it's the same thing, but not. Telehealth refers to all instances of healthcare via the use of modern technology, whereas mobile health refers to the concept of mobile self-care. So consumer technologies like smartphone and tablet apps that enable consumers to capture their own health data without clinicians' assistance or interpretation. Personally, I think of mobile health being maybe not quite as focused on clinical care and a clinical model, but more focused on consumers and helping people capture data about themselves. So unlike telehealth, which encompasses, clinician to clinician, like clinician to patient, mobile health more is limited to patient interaction, or in the future, it's expects to be more like patient self interaction. The total global mobile health market is expected to reach $100 billion by 2021. And that increase also leads to the next booming field, IoT and remote patient monitoring. So embedded ecosystem has led to a hyper-connected world and the growth of Internet of Things. IoT has connected all manner of endpoints and unveiled a treasure trove of data. This unprecedented volume of data has the potential to actually empower decision makers as never before, especially during COVID-19 pandemic, including efforts to contain its spread and help businesses stay afloat. They need to extract, visualize, and execute this intelligence in near real time is increasingly becoming a mission-critical objective. Later in our presentation, my colleague Tim will tell more about case that we have built for our clients where we actually used it. Also, with the amount of data that becomes massive, we expect cloud market increased almost twice during only 5 years. Besides just improving the quality of services and reducing the cost, modern technology allows medical institutions to save sensitive data safely while embracing cloud computing globally. With the amount of medical data in the world, now estimated to double every couple of months or so, healthcare was ripe for artificial intelligence, even before the virus struck. In 2019, study covering 19 different countries, artificial intelligence healthcare markets estimated almost 42% compound annual growth rate, from $1 billion in 2018 to $13 billion in 2025 in 6 different major growth areas: hospital workflow, wearables, medical imaging and diagnosis, therapy planning, virtual assistants, and lastly, but actually most significantly, drug discovery. COVID-19 will accelerate those trends rapidly. With sufficient data as a foundation, AI can also establish health data benchmarks for individuals and for populations. There are already huge opportunities for using AI models and algorithms for new drug discovery and medical breakthrough in genomic sequences, stem cells. One more technology that actually can help this area, and what I personally believe in, it's blockchain. It's particularly working really nice for pharmacy area. And one of the most promising benefits of blockchain from a patient safety perspective is to help stem the tide of so-called SSFFS, if I'm telling it correctly. So there's like substandard, spurious, falsely labeled, falsified, and counterfeit. It's medicines that continue to plug the pharmaceutical supply chain. A blockchain-based system could ensure a chain of custody log tracking each step of the supply chain at the individual drug or product level. For instance, Big Pharma currently uses several different software programs and databases to manage drug supplies. The introduction of blockchain system in which each participant controls a node on the network and each transaction requires a consensus would revolutionize the drug supply chain. And I have one more poll for you. What technology do you consider to implement first in your company? Here you can see 6 different variants. To answer, note that it's a multiple choice, so you're free to choose more than one answer. Please take your time. I will also tell out loud some for people who can't watch us right now at the webinar, but they will receive a video. So there are some options like general digitizing of existing infrastructure. Second option is video streaming, digital communication. Third option, workflows and data transfer automation. Then goes machine learning for predictions and data analysis. Then go AI-based help desk chatbot for common requests, or other, or don't know. Please take your time. And thank you for your answers. Now it's my pleasure to give the floor to my colleague Tim, who will introduce you to emerging technologies and use cases in the healthcare industry.
Thanks, Diana. Hi, everyone, again. So my section would be dedicated to the case studies we had built for our clients here at Intellectsoft. And I'll just explain you the approach we will take. So we'll start with a challenge, and I'll explain a bit more about the context, and then we'll move on to the solution, to the actual product we built. So yeah, to start, as we know, none of the healthcare systems were really ready for the COVID-19. And the most interesting facts is that we had a lot of shortage of medical staff. There were a danger of getting infection right at the hospital. Doctors who were getting infected too. So this is like a picture and reality we are living in for a couple of months now. So hospitals are not a safe place anymore, and visiting a doctor, like a regular visit to a doctor, is not something that sounds like something impossible. But the good news here is that the great challenges also bring a lot of new possibilities, and a lot of countries and governments are now much more open to alternative approaches and are willing to go digital as much as possible. And one of the solutions to the challenges we had is telemedicine. Yeah, next slide, please. So this is the platform we built for one of our clients, and the solution is very straightforward, but the most important thing that it's really work. So in this case, we've developed this platform for a private medical firm, and the main idea behind the solution is to leverage latest technologies, latest streaming technologies to digitize client-patient relations and apply this where it's more convenient. So the flow is following. You have ability to book a time slot with your doctor for a video call, but what's more important that if everything is booked, but the topic is urgent for you and you have no time to wait for a free slot, you also can exchange a short video messages with your doctor, and the doctor will answer when he will have a spare time, and also you can do it even on the go. So it's very simple and straightforward from the application. And of course, everything that can be automated is automated here. So all the notifications, the patient profiling, forms, payments are all automated. So this is really simplifies a lot. And next one, the next challenge would be more about the staff shortages. So since the pandemic um, hit the planet, the shortage of medical capacities are obvious. And the best way to prepare for the hits like this would be to plan ahead. And this crisis likely will lead to new efforts to build a large reserves of uh, masks, infection disease protection suits, maybe lungs ventilation machines or similar, and finally a reserve of medical staff, since it's much harder to scale and manage under this kind of conditions. Fortunately, there are solutions to this, and we actually built a system for this purpose in the past. So the idea behind this one is to empower medical institutions with a simple tool that gives them ability to manage and engage with their freelance staff based on the demand that they have. So on the other hand, it's also very beneficial to the people who are qualified to work at the hospital, but they don't want to have a full-time engagement. And also what's important is that the hourly rate in the app is dynamic, so it can be adjusted, and regularly it's much higher than the standard one because of the urgent nature of this kind of requests. So yeah, this is pretty beneficial for the medical stuff. And we've designed a solution that consists of two parts. The first one is iOS and Android application with an Uber-like feel for the medical stuff. And in this application, you as a medical person register, you select the closest and more convenient clinics to work with, or this application can also be configured to be dedicated to just one clinic. Then you provide photos of required documents, and also you complete a short survey to prove that you're qualified for the role. And then when it's time, you'll receive a request for shifts and can decide whether to accept them or not. And the second part of the application is the management part. So the web application for the hospital administrator or supervisor role. First of all, it is designed to manage and review all of the incoming job requests and to easily review all of the documents received. And the second thing is easy shifts and request management. And also one thing is, the last thing is that you can clock in and clock out at the front desk by using like a very simple iPhone application that dynamically generates QR codes for this clock in and clock out process for the best security. Yeah, so this is the case for the medical stuff. Yeah, and the next one, actually our job as a IT professionals is not to complicate already lengthy processes, but to simplify and bring easy access and convenience to existing infrastructure and available tools. So this is the goal number one. And one of the greatest, but I think least used resources in healthcare is its huge and massive, but very fragmented knowledge base. So we have books, we have magazines, we have medical research groups, we have labs, we have universities, we have clinics, all of this infrastructure, but still all these efforts and knowledge are locked and inaccessible for regular doctors. So there is no centralized or structured place when you can go to for the answers. And this is the place where big data analytics and machine learning can assist. And it can help to create these channels or single platform for users to get the structured data from. And it's not just structured data, but it also can be personalized to the context of one patient or one case. And maybe at some point, this kind of systems will be even available, not just for doctors, but for the regular people also. So the first solution, next slide. Yeah, so the first solution would be a big data platform that will aggregate first the structured data about all of the diseases, symptoms, coronary cases, maybe possible treatments. And on the other hand, you will aggregate all of the raw data received from the doctors about their cases, their diagnosis, all the steps they taken regarding particular case. And even more, the data from the medical equipment can be also streamed and connected to the case, or maybe the data from patient variables. And this data platform will learn and advise on the best scenarios or even predict the best next steps when it's possible. And for sure, it's not the silver bullet, and each case is unique, but with the time, the system would be more and more intelligence, and will have doctors, will give doctors an ability to not just build on top of their experience, but also build it from shared experience that is built in real time on the scale of the population. And we already built something similar to what I just described, but in a bit smaller, on a bit smaller scale. So we helped our client to build a very comprehensive and available tool for medical predictions. And it consists of two main parts. The first one is admin backend, where pre-selected doctors can input and enhance, update information about all of the available diseases and their symptoms and coronary cases. And on the other hand, it's easy to use and friendly, chat-like mobile application that is accessible for anyone and really understands the natural language. So you can tell this application your symptoms, and it will try to find possible answers and will help you to proceed with the next steps, and even suggest the best possible medical clinic near you or medical expert near you. So it's not just it's not a platform that I described before, in the previous solution, but it's really a great foundation, and this provides us with with a lot of answers and a lot of experience, and we can see that um, the the solution I described above is really not far away from the implementation. Yeah, the impact on health insurance is really hard to determine at the global level, because the impact will be very different from country to country, because in some countries such as US, for example, the most healthcare is privately provided, while in others such as Canada, it's more like from the public provision. But accessibility and digitization in this domain are very demanding right now. And we also had a case where we digitized the insurance process for one of our clients. So we have a case study in this domain, and we have created an app that helps users manage every step of the insurance process, from making an appointment and claims, and even to manage your child insurance. We have integrated this app with the most uh, widespread banking account authorization systems. So in this app, you can really sign documents in a quick and easy way, and in a digital way. And these apps were also integrated with the most popular doctor booking services in the country of our client. And we also completely removed the paperwork from refunds process. So for this, user just needs to take a photo, the photo of a check, fill a couple of forms, and just click on the button, and that's it. So the app were designed for a large scale, and were tightly integrated with the company's infrastructure. Yeah, next one. Yeah, I think this case can be better described by Diana, because she's very um, interested in this topic, and yeah, she can describe this case better.
Yeah, thank you, Tim. I will just jump to dialogue and we'll tell more about, there's always groups of people who require special care, especially during pandemics and other humanitarian crises. In such kind of group, we know that they're like elderly people, patients with mental diseases, transplanted patients, women who are isolated and they're like located with their abusers. And we as a company also thought how we can be helpful and create solution that can help such a group of people. And what we came up with, uh, it's an app that helps transplanted patients deal with seemingly impossible task of taking their medication in a like easy way. Oh, I can't even imagine how it's like hard to be going after like really hard and difficult surgery, and afterwards you need to take your medications all hours of the day and night. So we in the application created like alarm system that alerts the user when it's time to take their medication. It's interactive, educational, and simple to use tool that offers user like positive reinforcement for medication adherence. First of all, we are thinking that it's really easy to use for a child, but then we understand that even people who are mature and they're old enough to understand that gamification isn't everything, but still they're using and really enjoying it.
Yeah, thanks, Diana. Yeah, so this is it for the use cases we prepared for you today. And I wanted to continue with another multiple choice poll. So we're curious which of these use cases we've described you above best fits your company current challenges, or maybe um, the use cases you were most interested in. So please take your time and provide as many answers as you want. So the question is, which of these use cases best fit for your company's current challenges? And I'll go through some of the items. So first, telemedicine. Second is staff management platform. Then knowledge base sharing and predictions platform. App with AI-based diagnosis. Um, digital insurance or similar, and rehabilitation program with wearables integration, or other, or none. Yeah, take your time to answer the right questions, the right answers. Okay, thank you for participating in this surveys, and this is really helpful for us. And the final section we'll have is the next steps, so the digital strategy and how to build it, and how we usually tackle this problem. Yeah, next slide, please. So yeah, I think after hearing from us about all of these use cases, maybe you found something that is really echoes you, and you think that it's a good idea to start digitization, but in case you don't know where to start um, this digitization is not a really a simple task, and even in this in this spheres. So I'll just tell you more about how we tackle our projects, because as you know, we experience in a lot of um, sectors, and we receive a lot of project requests every day. So how we tackle this, we usually have something we call a discovery workshop. And this is something that can be done in the context of a project, or maybe as a separate activity. So in this discovery workshop, what we do is usually we crystallize the approach, the strategy to how tackle the problems, and also we build a lot of technical documentation around around the strategy that can be that will be helpful when you decide to start a project. Yeah, next slide, please. Yeah, so if we get into details a bit more, how we usually structure this. So the first, we dedicate a team of the people with the relevant experience to this domain, and we split the process to 3 weeks. It's usually 3 weeks, and the first week, and we usually call it a 0 week. We usually do it remotely. So this week is dedicated to first all of the knowledge transfer to all of the researchers that are required we study the documentation. We also do a couple of calls with the stakeholders to understand the scale and the landscape of the problems. And then there is second week, and it's always on site, so face to face. It's either we fly to you or you fly to us, and we sit and think about the possible solution. So we already know the context, we already know the domain, but then we bring our technological experience, and we shape the solution during this week. So in the end of this week, what we'll have a detailed um, and prioritized feature list with different phases and different stages of a product. And also, we also have a, uh, a clickable prototype just to check whether our vision is really aligned with your vision, to check whether everything feels and works as it should be. Yeah. And the third week, or it may be even third and fourth week, it's the time when we actually produce all of the technical documentation, all of the designs or designs variations, where we estimate all of the efforts required for the different phases. We do a couple of iterations to make sure that everything is right and prioritized right, and maybe we do some adjustments during this time. And then at the end of this process, we deliver a huge pack of documentation, designs, wireframes, architecture, diagrams, user stories. So everything that is needed really to kick off the project and to really understand what you're building, and and uh, and how much time it would take, and how much effort it will take. So this is the process, how we usually do it, and it's really how we do it for every incoming project. So it's this framework is very developed and extensive on our side. So yeah, this is how we do it. I think I hope this was useful for you, and it would help you to understand the next steps if you have some some real projects in your mind that might be helpful for your company. Yeah.
Thank you, Tim, for insights and for sharing your experience. I will try to sum up. So as we see, there are a lot of challenges around digital transformation in healthcare industry. So it should be considering a variety of technologies, use cases, and solutions. And Intellectsoft has strong domain expertise for advising the right solution to solve particular business challenges and avoid pitfalls while delivering and deploying them. So before we end the webinar, we have several questions from the audience to answer. And by the way, please feel free to add new questions through the chat as well. Let me start with the first one. So any successful blockchain-based solutions all seem to be in nascent stage. Maybe I will start. I know the team is also head of our blockchain department, and he was working with a lot of blockchain startups before. I can also tell from my experience more from business side. Actually, I know several successful startups which are already working, and they're not just deployed, but everyone is using them. For example, I know one in Ireland, and it's a really good example how pharmacy can benefit from blockchain technology. When you're going to pharmacy or apothecary, you're just using your mobile phone, you're scanning a QR code that you can find on the pillar medicine, and you can track all the way how these pills were going through the plant. Even you can track the road, where they were going, which date. Again, it's helping to prevent illegal medications. It's helping also to prevent, uh, pills that are not allowed in the country, or they needed to be dropped out or even like ruined before. So maybe we will go with the next question, or maybe Tim has something to add. Okay, we will go with the next one. Uh, what about dental ideas? Again, there's a lot of really successful cases, even in our company. We have done one project that I'm really proud of for our client. Maybe we also can understand that in dental processes, in dental clinics, there is a lot of trust and timing issues with their subcontractors, just because when you're going to the doctor, uh, you're not expecting to have I don't know, like immediate treatment. Sometimes you're not going just to whiten your teeth, but to order, I don't know, braces, for example. So you're walking to the doctor and you're ordering all things for braces, and these different parts should be delivered from different clinics and should be delivered and done shaped personally for you from different locations. So we have created smart calendar that is helping to make a perfect estimation, not just ballpark one, when this, for example, braces will be delivered to the clinic, and when you can go to the doctor and you will have an appointment. So maybe we will go with the next question. So next question is, how can security be improved in healthcare? Top places to look at. This, I guess, question is totally for Team. Team, can you answer it, please?
Yeah, sure. Thanks for the question. Um, yeah, so this is a really relevant question um, for this sphere and our topic. So the healthcare is really famous for its privacy and for its security requirements, all of the regulations, um, and but still, I think there is a lot of places where you can look at to improve and to check whether you're compliant. So I would I would say that top places to look at would be first your infrastructure security and your network, because in healthcare there are a lot of integrations usually, and there might be a lot of weak points in this kind of on this kind of side. And medical organizations don't always take the time to examine all of the vulnerabilities of their infrastructure. So that's why insights from external party can be very crucial. Um, yeah, so we usually suggest and recommend the third-party security assessment. Yeah, we don't do this kind of assessments usually, maybe in context of a project, but yeah, usually we suggest to go with the experts in this case. Second thing to look at is the password management policies, or integrate some software for this, because we all know the cases where some password was written down on the sticker, and then during some interview it got caught on the camera, and then the institution had a lot of problem with this. So it's very important to have this kind of policies, to educate your staff about the importance of security. And also, one thing that can help here is the second factor. If there is an option to have a second factor on sensitive processes, so confirmation through SMS or something like this would be really, really secure and helpful. And also from our experience, the one place to look at is device management and like device tracking systems, because this kind of like organizations with this kind of scale and this amount of devices can really be messy, and it's very difficult to know who is using what. Um, yeah, this might be a place for the security bridge also. So yeah, I think this is the top three places to look at. So the first is, as I said, the infrastructure and network security, all of the integrations security. Second is password management, either software or policies. If it's possible to have second factor, you should really have it. And then, yeah, device management and tracking systems.
Thank you, Tim. So next question is, how do you see the future of healthcare, at least for the nearest future, 5-10 years? Well, I will go with this one. And I guess I should start that I truly believe in globalization. So I'm sure that in 5 years, we will finally have one unified standard to save all the data. But if you're asking me how I imagine my morning of the year, let's say 2030, I would say that I'm waking up and notice that I have a sore throat. So I get up and walk to the bathroom. While brushing my teeth, a special sensor on the bathroom mirror already checking my temperature. In a minute, I receive an alert from my personal like AI physician assistant from Gadget and showing some abnormal measurements from my saliva sample, and that I'm also running low fever. So this personal assistant further suggests that I will take fingertip needle so they can check my blood test. And while, let's say, having breakfast or like brewing coffee, personal assistance returns with results of the analysis, and they're saying, okay, maybe I have a flu, one of the two types around the season. Then personal assistant suggests 2 video calls, time slots with my family doctor. So I need consultation with someone, and doctor will have all the details of my symptoms, and even she will have it even before the call, and after the call she prescribes paracetamol, and let's say a drone will just deliver it to my door. So that's how I see that the future will look like. uh, I hope I answered it, but feel free to ask more. But we still have some questions. Okay, maybe. Okay, let's go with this one. How to solve the situation when a patient doesn't want to communicate or disclose important information? What solutions can you suggest here? Maybe Tim, you will answer it.
Yeah, sure. Okay, so yeah, as you know, the privacy is very important in the healthcare, and I think the digital way of keeping it is much more flexible than if you do it like in the real world. So you really cannot, or it's very hard to keep your privacy um, if it's like either face-to-face meetings or something like this. So, but we can do a lot in a digital way. So the first thing is, for example, we can have a platform that knows a lot about you, and it's really secured and compliant, of course. But it can connect you to the doctor, but the doctor won't have access to your um, to your personal data, like personal identifiable data, but he would just know about like everything about your case, about what's happening, and the history, but he won't know who this actual data belongs to. So this would be one approach to take. And yeah, in this platform, the platform would know your actual name, and you will be like pre-screened to keep from the scam or something like this. But yeah, this process can be done through some kind of a some kind of a third party that would pass the consultation process around between the patient and the doctor. And I think also what can be used, you even can do like a telemedicine in a live manner. So you can do a video calls, but we can adjust your voice, like a voice tone, in real time, and also we can use something that we experience in Instagram lately. So the masks functionality. So you can not just hide your face, but and voice, but really do it in a very private manner from this kind of application. So this is also possible, and I think there are a lot more possibilities that we can integrate in a digital way. But yeah, I think I have to think about more cases to get more ideas. Yeah, but I think yeah, this would be my answer. So it's a lot more flexible than in the real life, and there are a lot of options to choose from.
Thank you, Tim. And I believe that it's time to wrap up, but let's take the last question from the audience. And like, don't be afraid if we skipped your question or we didn't have time to answer it. I will be back to you. So we will be back with an answer. So feel free to ask more questions, but let's finish with the last one. So the question is, what is the estimated budget range for telemedicine software development? And it's really impossible, to answer with one sentence or just with the exact number, just because there are so many things and so many factors that depends on. What I suggest you to reach us. You can write me. Here is my email and also email for our company. If you can provide details, or we will set up a call. I will learn more about your project idea. We will go through them with our technical team, and we will be back with an estimation. Because unfortunately, it's impossible to, put one price range, because it's really depends on your idea, what features you want to add. Also, I want to highlight and point that consultation from us you will get totally for free. So don't hesitate to write me, and let's set up a meeting. I really thank you for your time and that you were with us during whole webinar. I wish you a great evening, and stay tuned for the new activities from Intellectsoft. Goodbye.
Yeah, bye guys.